Hi, occupational therapy students. My name is Stephanie from Pass the OT, and today I'm going to provide you with a clinical simulation breakdown. This one comes from Neurological Conditions and Intervention from Pass the OT. So here's the scenario. An OTR is working in an acute care hospital and receives orders to evaluate and treat a patient with a diagnosis of acute right cerebral vascular accident with left-sided hemiplegia. A brief chart review completed prior to evaluation revealed that the client is a 76-year-old female with a history of type 2 diabetes. She lives in her own home with her husband. When the OTR enters the room, the patient makes eye contact and says hello. The patient attempts to sit up in bed, but is unable to voluntarily position her left arm and her left leg as she moves from supine to sitting. She asks the OTR for a brush while pointing to her water jug. So in section A, based on the information in this scenario, how should the OTR proceed with the evaluation? So we need to select the best three choices. Answer choice A, measure passive range of motion of the left upper extremity using a goniometer. B, complete a manual muscle test of the left upper extremity. C, palpate muscle activity in the left upper extremity as the patient moves the right upper extremity. D, screen visual tracking and peripheral vision. Or E, screen tactile sensation of the left upper extremity. Or F, complete an IADL evaluation. So let's see how we get to the answer choices, and this should be really simple. So in step 1, when I look at every answer choice, I realize they are all related to screening and assessing the patient. So in number 2, we want to understand the information we know about the patient. So we understand that it's a 76-year-old female, acute right CVA with history of type 2 diabetes, admitted to acute care hospital, presents with left hemiplegia, and when attempts to sit up in bed, unable to voluntarily position her left arm and her left leg as she moves from supine to sitting, which is suggestive of a hemiparesis paralysis, makes eye contact and says hello, which is appropriate. Asks for a brush while pointing to her water jug, which may be an indication of heminopsia, visual inattention or neglect, or visual agnosia. She is married, lives with her husband in her own home. So let me explain to you what heminopsia is. It's a condition in which a person sees only one side, right or left, of the visual field of each eye, and this condition is created by a problem with brain function rather than a disorder of the eyes themselves. An injury to the right side of the brain produces loss of the left side of the visual field of each eye. So visual neglect is a common neurological disorder following stroke characterized by a deficit in attention and appreciation of stimuli on the contralesional side of the body. And visual agnosia refers to a lack of recognition of or understanding of visual objects. It is a disorder of higher cortical function. The strict diagnosis of visual agnosia requires intact visual acuity and language function. So in step 3, we can conclude that the answer needs to address how we identify the 3 most appropriate screening assessments to begin OT evaluation of this patient. So now we can look at the answer choices. A, measuring passive range of motion provides information about the integrity of the joint, but not about the capabilities of the muscles. Passive range of motion should be screened prior to taking any goniometer measurements. If passive range of motion is functional, goniometer measurements are not necessary. When I look at the answer B, the patient would not be able to participate in a full muscle manual test as her inability to voluntarily position her left arm and her left leg as she moves from supine to sitting suggests that she has a hemiparesis paralysis. When I look at the answer C, her muscle activity should be palpated. It may be easier to feel muscle activity in the left upper extremity if palpation is done while the patient is moving her right upper extremity. This is based on the cross-activity theory. Unilateral muscle contractions in the upper limb produce motor cortical activity in both the contralateral and ipsilateral motor cortices. The increases in excitability of the cortical motor pathway activating the resulting limb has been termed cross-activation. When I look at the answer D, screening visual tracking and peripheral vision is important post-CVA, as visual impairment is common and may include impaired central vision, impaired peripheral vision, visual field loss, eye movement disorders, and visual perception disorders, including visual inattention. So peripheral vision problems mean that you don't have a normal, wide-angle field of vision, even though your central vision may be fine. And when I look at answer E, somosensory loss after stroke is common. Sensations such as touch, vibration, temperature, proprioception, and pain. Monitoring the loss and recovery is important. And when I look at the answer F, the patient would not be ready for an IADL evaluation, but an ADL evaluation would be indicated. So number 5, cross-referencing the question to the answer. We know it relates to, so we know the answers are C, D, and E. So palpating the muscle activity in the left upper extremity as the patient moves the right upper extremity, and D, screen visual tracking peripheral vision, and E, screen tactile sensation of the left upper extremity. So altogether, we know for the rationale that the patient is a new admission. The limitation caused by the CVA are new and her functional abilities are not yet clear. From her movement in bed, it can be observed that the patient has no or severely limited function in her left upper extremity. Passive range of motion should be screened prior to taking any goniometer measurements. If passive range of motion is functional, goniometer measurements are not necessary. The patient would not be able to participate in a full manual muscle test. Her muscle activity should be palpated. It may be easier to feel muscle activity in the left upper extremity if palpation is done while the patient is moving her right upper extremity. Screening of visual motor skills and tactile sensation can be completed to determine if more in-depth evaluation is necessary. The patient would not be ready for an IADL evaluation, but an ADL evaluation should be completed. I hope you enjoyed today's video on clinical simulation breakdown from Pass the OT. We do look forward to assisting you with more of your questions and concerns regarding passing the test. Have a great day, and we do look forward to helping you become occupational therapists.